Welcome to this webinar from A Place in the Sun. My name's Andy Bridge, and today we're discussing the provision of healthcare in Portugal post-Brexit. And I'm delighted to be joined by Marta Theia, who's the Consular Policy Officer at the British Embassy in Lisbon, and Sarah Owen, the Healthcare Policy and Communications Advisor at the Department of Health and Social Care based in Madrid. Welcome both, and thank you for your time.
Hi, Andy. Thank you very much.
So today we aim to clear up some of the confusion surrounding the provision of healthcare in Portugal post-Brexit. We have 6 statements for you to decide whether they're true or false before hearing the answer from our resident experts, along with an explanation. So when visiting Portugal, you can still use your EHIC card or replacement GHIC card if you need to visit the doctor. True or false?
The answer to that is true. So the agreement which the UK made with the EU, which is the Trade and Cooperation Agreement, means that UK residents can continue to use their EHIC card, the European Health Insurance Card, when travelling to EU countries as before. So you can continue to use that EHIC card until its expiry date. There's no need to take any action to apply for another card until it expires. Okay, and when it does expire, that's when you apply for the new Global Health Insurance Card, which is the new card that reflects the fact that the UK is no longer part of the EU.
Fantastic. That's welcome news for holiday makers, somebody visiting a holiday home or a temporary visit. It doesn't replace travel insurance, and it is for primary healthcare, I believe. Can you explain a little bit about what that term means?
Absolutely, yeah. So for anybody visiting a second home or visiting Portugal on holiday, it gives you what we call necessary care. So it's not primary care, it's necessary care. So that anything medically necessary whilst you're on your temporary stay in Portugal, that might mean a trip to see a GP, medication that you've run out of, if you have an accident, A&E cover, anything that's medically necessary, it's what either card covers you for. So whether you've got an EHIC or a GHIC, both cards cover you for the same care. And you're very right in saying that insurance is also a really important thing to travel with, because the EHIC or GHIC won't cover you for every eventuality. So for example, it won't cover you for things like mountain rescue, or if you needed to be flown home through medical repatriation. So it doesn't cover you for all things, but it's really important to travel with both if you can. So either the EHIC or GHIC plus travel insurance that meets your healthcare needs as well.
Thank you, Sarah. If you retire to Portugal before pensionable age, you do need private healthcare. True or false?
This is false. Healthcare in Portugal is residency based, and this is regardless of your nationality or your social security status. So if you are a registered resident in Portugal, you have access to the healthcare, the state-sponsored healthcare system, just like any Portuguese citizen. Now, one little thing is that for new residents, so those who come to Portugal after the end of the transition period, so from the 1st of January this year onwards, there is a requirement for you to get a visa to come. You will need to have health insurance for the duration of the visa and until you get residency in Portugal.
Okay, again, welcome news and very clear. Thank you, Marta. A UK pensioner retiring to live in Portugal post-Brexit can get free healthcare. Is that true or false?
So the answer is true. So regardless of the fact that healthcare in Portugal is a residency-based system, if you're a UK state pensioner and you're moving to Portugal, you are entitled to have your healthcare costs covered by the UK government because you are a UK state pensioner. So you would be entitled to apply for an S1 form. And that is a scheme which continues despite the fact that we've left the European Union. It's part of the agreement that we made with the EU. So in the same way that EHIC or GHIC continues to be in place, so does the S1 scheme for those UK pensioners who plan to live abroad in Europe. So they would be covered. They need to apply for an S1 form via the Overseas Healthcare Service. And I'm sure we'll put details of how to contact them after the webinar. And then you apply for that, you get the form through to your Portuguese address, and then you would register that locally. And that's a really important step, that once you get the form through, you would need to register that locally for that cover to take effect. And then for those details to be sent back to the UK, so you're formally covered for healthcare costs by the UK government whilst living in Portugal.
So the starting point is the S1 form.
That's right.
Wonderful. Well, again, that's going to be very welcome news. We recently surveyed our audience of users on aplaceinthesun.com, and 7,500 people kindly completed our survey, and 73% of them got that wrong. They thought you could not access healthcare if you were retiring to anywhere in the EU post-Brexit. But so this is not just for Portugal. Then this is EU-wide: Spain, France, all the other popular destinations. Sarah.
Yeah, so for those who are eligible for an S1 form, so UK state pensioners, that would apply to any EU country. So they would, if somebody moved to France or somebody moved to Germany, likewise, the same scheme applies in EU.
If you move to Portugal for work, with obviously an appropriate work visa in place, you can pay into and benefit from the Portuguese National Health Service. Is that true or false?
That is true. You do pay for it because you contribute towards the system through your work. However, healthcare is residency-based. So even if you do not work or have a pension in Portugal, you can still access the healthcare system because you are a resident, so through your residency.
Okay, again, a very clear answer. So in fact, some of these questions that are specific about work status or retirement status, they're almost irrelevant. Once you're resident, that's the access point to healthcare.
Yes, it's about residency. Of course, as Sarah already said, there are a different number of pathways for who pays for your healthcare in Portugal. So if you have a pension from the UK, you are what we call an S1. So that means that the UK is responsible for your healthcare in Portugal. So it is important that you register with your S1 form, but the access to it is always the same for every resident in Portugal.
After moving to Portugal, you will still have free access to the NHS when visiting the UK. Is that true or false?
So in general, the answer to that is false, because the NHS is a residency-based system. So you need to be ordinarily resident in the UK to be able to use that system. There are slight exceptions to that. So some groups of people, such as students or detached workers, so that's somebody who's been posted to another country to work by their UK company, and S1 form holders who were living in the EU before the end of the transition period, so before the 1st of January 2021. There are small exceptions to that, but generally speaking, once you move away from the UK, if you move to Portugal, you don't automatically retain access to the NHS. So it's really important that when you're travelling back to the UK, that you travel with insurance that meets your needs. And if you're eligible for a Portuguese issued EHIC, that you travel with that, and that would cover you for any medically necessary care back in the UK. And perhaps Marta wants to explain a little bit more about how you might be eligible for a Portuguese issued EHIC.
Thanks, Sarah. Yes, so if you are a resident in Portugal and you're not covered for healthcare by the UK, meaning that you're not a pensioner, not a student, you're not a posted worker, or by any other European member state, you are entitled to ask for a Portuguese issued EHIC on basis of your residency. You do not need to have a social security number to do this. You just need to have your NIF and your health number to do it in Portugal. And you do it by going to a social security office and ask for one. So this EHIC will allow you to get emergency care when you visit other EU countries or when you visit the UK.
Great. So this is the reverse of what we spoke about at the top, which is a British resident holidaying in Portugal using their EHIC card to access emergency care. This is just the same thing in reverse. You're now a Portugal resident and you're using your Portugal issued EHIC card to access healthcare in the UK. Fantastic. That's very clear. Thank you. If, as a UK citizen, you move to Portugal with your EU partner, you are entitled to free healthcare. Is that true or false?
That is both true and false, because you are entitled to healthcare, but not because of your EU partner. You are entitled to it because you're a resident of Portugal.
And that completes our 6 questions today. These are the 6 most prominent questions gleaned from surveying our audience that we wanted to get answered today. And thank you to our resident experts, Sarah and Marta, for doing that so clearly. Thanks for watching, everybody. We hope we have alleviated some of your fears about the provision of healthcare in the EU and specifically Portugal post-Brexit. Thank you for watching again, and goodbye.